ICU requiring ventilator care. So before I move on to rest of the presentation, let's go over some myths and see if there's any truth to that. And you must have seen many of these on social media. Some of you may have forwarded these as well. And my request, my humble request and plea to you is, please do not forward any such information on social media, because some of this can be actually harmful. So let's go over some of these myths. Number one, true or false? COVID-19 is like the regular flu. And since this is not quite an interactive session in person, so I'll just go ahead and start answering these. This is quite false. COVID-19, while it is more infectious than regular influenza, it is more lethal as well. However, while it is more infectious than other recent novel coronaviruses like SARS and MERS, it is less lethal than those two, but it's quite different than regular flu. The mortality rate from COVID-19 is somewhere between 5 to 10 times higher than the regular influenza infection. There is a myth which goes on that since I'm young and I have no other comorbidities, I have nothing to fear from this infection. Also false. While it is more likely to cause serious illness and death in older people and those who have chronic medical conditions like heart disease, kidney disease, liver disease, lung disease, there are plenty of severe cases and death, and even deaths in the younger population. It is also important to know that young people play a significant role in transmission of infection because generally they have lesser severe disease overall, and they feel that they are not infectious and they go on and transmit the infection. I keep seeing posts on social media that a vaccine to cure COVID-19 has been approved, has been marketed, it's going to come to the market very soon, and so forth. This is quite false. Vaccine trials have started. The first group of patients have been enrolled. However, because of the vaccine development and marketing cycle, a safe, effective, and viable vaccine is at least 12 to 18 months away right now. So till we get that, we have to use other means of controlling this pandemic. Another group of myths that are going around is various what we call totkas, like Zubaida Appa's totkas. You can protect yourself by swallowing bleach or gargling with bleach, taking steroids, using certain oil, doing saltwater gargles, drinking warm water, or applying heat to your mouth and nose by using a hair dryer, which generates a hot jet of air. All these are quite false. There is no truth to such remedies being touted on social media. While some things may be helpful, meaning saltwater gargles are generally helpful for general wellness, they do not do anything for COVID-19 or SARS coronavirus 2. And like I said, my plea is do not forward or share these posts, because some of these actually may be very harmful to people. Like gargling with bleach can actually cause significant damage to your esophagus. Dr. Asad Chaudhary is a gastroenterologist, so he can tell you that this can be very, very damaging. There's also a myth that the new coronavirus were deliberately created or released by humans as a bioterrorism agent. There was a very elegant paper in Nature Medicine, which I referenced earlier. There is no truth to this. Genetic sequencing and evolution of the genetic material of this virus has conclusively shown that there was natural selection of this virus. People ask me whether ordering or buying products shipped from China will make a person sick. Again, this is false. There is no evidence of any transmission through trade or trade goods. In fact, the fact that infection rates have dramatically reduced in China and exponentially increasing in many other Western countries, common sense dictates that quite the opposite may be true. I would worry more about other places than China as a source of infection right now, but no known infection transmitted from trade goods. People are hoarding masks with the belief that a face mask, like a regular surgical face mask, will protect them from COVID-19. That is not true. For proper protection, you need a professionally fitted N95 mask, and you have to have fit testing done, which is a specific procedure to determine whether the mask is the right size for your face and has achieved a full seal. Neither CDC nor WHO recommend regular face masks for all persons. However, people who do have symptoms of a respiratory infection should wear a surgical mask. This prevents them from spreading infection to others. But if you wear a surgical mask and come across a person who is coughing onto your face, that probably or may not protect you well from acquiring the infection. It may decrease the rate of transmission or giving to another person.